Okay, everyone, this is Michael Echeverria here at Home Health Success Academy and 10xPatientReferrals.com. And in this particular series, we're going to be talking about marketing to nursing homes. Okay, so nursing homes have a variety of different names. You have your skilled nursing facilities, your SNFs, your rehab facilities, and so forth and so forth. But in the end, I just like to say they're a nursing home, right? That's what we pretty much know them as. All these different, marketing, branding ideas of changing their names to a bunch of different things is perfectly fine. But listen, everybody knows them pretty much as nursing homes. So in this training, what we want to do is we want to be able to break down and understand the nursing home. And the reason why we created this video series is that a lot of marketers that jumped into the home health industry, okay, they're salespeople from other products, other services, and then all of a sudden they want to jump into the industry of healthcare and home health. And we want to be able to give them a breakdown of what they're going to be expecting and what they're going to be seeing, okay? So we want to be able to address this training to people that are just getting into the industry, as well as give a little bit more information for people who kind of have an idea of what a nursing home is, but breaking it down into the techniques and the ideas and the sets that you need to do if you are going to be marketing to a nursing home, a rehab facility, a SNF unit, whatever you want to be able to call it. So let's break down a basic nursing home. What is a nursing home? Okay, so nursing homes or rehab facilities are sometimes a step-down facility of patients or seniors, let's say, for example, who end up in the hospital, and unfortunately they cannot go home automatically because they still need some form of rehab, some form of assistance, some form of training. Okay, so they can be discharged from the hospital because they don't no longer qualify to be in the hospital, but at the same time they still need some service before they can go home. Okay, so that's what it is pretty much. And so in the nursing homes, you guys, if you don't know, let me give a quick explanation. They're going to have what they have, the short-term and the long-term area, right? So the short-term stay, those patients that are in short-term, these are the type of patients that we, as a home health agency, want to be able to obtain, okay? These are those patients that we want to be able to grab because more likely they're the Medicare patients. They have the insurance that's going to pay for home health services. Now, if you're a home care company, if you're a home care marketer, you actually can target both long-term and at the same time is short-term as well. And so let me explain. So, for the short-term, when they get discharged to home, they may need home health services, but they need additional caregivers that's going to be there 24/7 with them or a little bit more hours, or they may need just some basic assistance as well, some per diem work. Now, in the long-term care areas, we've also seen a lot of home care companies, non-medical, provide services for the long-term. Because here's the thing, when patients are in long-term care, what happens is that their care is divided among staff. So they may have a nursing assistant that's taking care of 10 other patients. And so there's not that one-on-one care that could be given to them. So a lot of family members we have seen actually has hired caregivers to at least come in to see their mom, their dad, their grandparents, at least maybe a couple hours a day just to be able to make sure that they're doing well. And I've even seen it where they've actually been there for more than 8 hours. Okay, caregiving companies can also be hired to provide caregivers and for long-term care patients because the patient is a fall risk and needs 24-hour monitoring. Okay, so these are just basic things that we need to be able to explain to you guys. Now, you have to understand the nursing home, the rehab facility is ripe for potential patients for you. They just are. They're discharging, some places are discharging 3 to 5 a week. Some of them are discharging 5 to 10 a week. So it's a matter of being able to research and figure out which home health agency that you're in, which do you guys want to target as a nursing home. But you have to understand that a good thing to do is to actually go after all the nursing homes. But at the same time, if you have more than 50 nursing homes, within your service area, it's going to be hard to fully target all of them all at once. So this is where we talk about in our sales process implementation and creation video series, is where you should actually look into creating that sales process that you should have and learning how to be able to do a research in your area. Now we're going to dive deep into more of the research part of the whole process as we further go and continue on with the rest of the videos of this program. So I just want to be able to say, this is a good thing that you guys are watching this video series. It's an amazing thing that we can actually put together something for you guys to prepare you guys. It's about preparation, and that's the most important thing if we are gonna go and market to a particular facility. Now we have other video series such as how to market to a hospital, how to market to an assisted living facilities, and how to market to your physicians. Now these are also good series that you should also look into if those are certain things that you're going to be targeting as well. But in this video series, we want to be able to talk about several things: how to be able to research the type of nursing home and rehab facilities are in your area, how to be able to segment and to be able to categorize which one are a good fit for you. The next thing is how to be able to research fully and find out who are you going to be targeting within that particular facility. Who can you actually bring with you, or who can you actually reach out to that's going to get you into these facilities. The next thing is how to be able to present to them, what to present to them, what to expect to be able to say to them, what are the problems that you're going to face when you're walking into a facility, okay? And then, what are the things that you guys can actually make sure you include in your presentation that's going to make sure that they look at you differently from the other agencies that have actually entered into these facilities to try to market their services. So that's what the main thing that we're going to be covering in this video series is how to be able to give you, a robust information that you guys can actually use and actually start implementing some of the techniques that we're going to be sharing with you so that you can take this and start marketing to these facilities so that you can start increasing the branding and the knowledge of these facilities about your company. So let's go ahead and get started. And I definitely look forward to sharing with you guys a lot of information, a lot of insight on what I've done and what other people have done to be able to get into these facilities. Let's go ahead and get started.